Hello everyone, my name is Nausheen Parveen. I am assistant professor in IIMT College of Pharmacy, Greater Noida. In today's lecture, I am going to discuss about drug use for bronchial asthma. What is the bronchial asthma? Bronchial asthma, impairment of airflow due to the constriction of bronchial smooth muscles and constriction of bronchial smooth muscles also called as bronchospasm. And other factors which cause bronchial asthma, that is allergy, infection, psychological factor. Another factor is airway obstruction, may be due to release of mediator from sensitized mast cell in the lung. Bronchial asthma, types of bronchial asthma: acute asthma, chronic asthma, status asthma. And what is the acute? Acute means which asthma caused within a 7 days or 15 days is called acute asthma. And what is the chronic asthma? Chronic asthma which is caused within a 15 to 1 month or more than 1 month is called chronic asthma, and the status is a acute severe asthma. Classification of anti-asthmatic drug. Bronchodilator, first class is bronchodilator. So why we are using bronchodilator? Because in asthma, bronchia is constricted, so that's why we are using bronchodilator. So first subclass of bronchodilator is sympathomimetics. And when we further class or divided in sympathomimetic is selective beta 2 adrenergic agonist and non-selective beta adrenergic agonist. First is selective beta 2 adrenergic agonist, and it is further divided into two classes: short acting drug and long acting drug. First is short acting drug, and examples are salbutamol, terbutaline, and long acting beta 2 adrenergic agonist is salmeterol and formoterol. And next is non-selective beta 2 adrenergic agonist is adrenaline, and next class of bronchodilator is methylxanthine. And examples of methylxanthines are theophylline, aminophylline, etiopylline. And next class of bronchodilators are anticholinergic. Ipratropium bromide, tiotropium bromides are the example of anticholinergics. Next class of anti-asthmatic drug is leukotriene receptor antagonist. And example are zafirlocast, montelukast. Next, mast cell stabilizer. Examples are sodium chromoglycate, nitochromyl sodium, ketotifen. Next class of anti-asthmatic drug is glucocorticoids. And when we sub-classify glucocorticoids, first one is inhaled glucocorticoids, and second is systemic glucocorticoid. Inhaled corticoids examples are beclomethasone, budesonides, fluticasone. And next class is semi-synthetic glucocorticoids. Examples are hydrocortisone, prednisolone, prednisolone. Next class of anti-asthmatic drugs are anti-IgE monoclonal antibody. Example are omalizumab. So next is mechanism of action of sympathomimetic drugs and or bronchodilators, which is like when we are using sympathomimetic drug, It will act by stimulating beta 2 receptor in bronchial smooth muscle and mast cells, and then it will increase CMP pathway and produce the effect bronchodilation and inhibit the release of histamine and SARS-A like leukotriene C4 and leukotriene D4 and from mast cell. Next activity is promote mucociliary clearance. Next is when we are divided sympathomimetic subclasses, selective beta 2 adrenergic agonist. So property of selective beta 2 adrenergic agonist is it is a first line bronchial asthmatic drug, uh, well tolerated when inhaled. At high dose may cause tremor, tachycardia, palpitation, hypokalemia. Next class of sympathomimetic drug, uh, selective beta 2 adrenergic agonist, and when we are divided the classes, and it is subclassified into short acting and long acting. So short acting examples, so short acting beta 2 adrenergic agonist examples are salbutamol and terbutaline. The property of short acting drug is when we are use salbutamol and terbutaline by inhalation, they have rapid onset of action within 1 to 5 minutes and short duration of action. Prefer for acute attack of asthma. And next is long acting selective beta 2 agonist. Examples are salmeterol, and property of salmeterol is it is preferred for maintenance therapy of asthma. It is not suitable for acute attack as it has show onset of action. And next drug of long acting selective beta 2 agonist is formoterol, and it has a rapid onset of action. Next class of sympathomimetic drug is non-selective beta 2 adrenergic agonist. Example is adrenaline. Adrenaline produce strong and powerful bronchodilation by acting through beta 2 adrenergic receptor. Useful in acute attack of asthma. It used decline due to the serious cardiac side effect. Next class of bronchodilator is methylxanthine. So methylxanthine, their use are markedly reduced due to their narrow therapeutic index and available of better anti-asthmatics drug. Methylxanthine are third or fourth line drugs in the treatment of asthma. Methylxanthines are well absorbed after oral and parenteral administration. Food delayed the rate of absorption of theophylline. When theophylline intact, it is well distributed and cross the placenta and blood-brain barrier, and theophylline metabolized in liver and excreted in urine. Other property: theophylline poorly water soluble, hence not suitable for injection, available for oral administration. And next example of methylxanthine is aminophylline. It is water soluble but highly irritant, administered orally or slow IV action. Etophylline is a next example of methylxanthine class given by oral, IM, and IV route. Adverse effect of methylxanthine have narrow margin of safety, tachycardia, palpitation, hypotension, death due to cardiac uh, arrhythmias. Uh, Mechanism of action of methylxanthine and theophylline and aminophylline are the drug which inhibit the phosphodiesterase enzyme, and it increase the CMP pathway and cause bronchodilation, inhibit the release of histamine, SARS-A from mast cell, improve the mucociliary clearance in respiratory passage. Next, the adverse effect of methylxanthines on CNS, it causes restlessness, insomnia, headache, tremor, convulsion, and on gastrointestine irritant, cause nausea, vomiting, gastritis, and aggravation of peptic ulcer. And on heart, the adverse effect is tachycardia, palpitation, hypotension, sometimes sudden death due to cardiac arrhythmias. Next class of anti-asthmatic drug is anticholinergic. Examples are ipratropium bromides, tritropium bromides, are atropine substitutes, selectively block the effect of acetylcholine in bronchial smooth muscles and cause bronchodilation. So, slow onset of action and are less effective. These drugs are preferred in COPD, administered by inhalation route. Combination with beta-2 adrenergic agonists have better effect. Next class of bronchial asthma is leukotriene antagonist. So, leukotriene antagonist drug competitively block the effect of cysteine leukotriene like leukotriene C4, leukotriene D4, leukotriene E4 on bronchial smooth muscle, produce bronchodilation, suppress bronchial inflammation, decrease hyperreactivity, well absorbed after oral administration, highly bound to plasma protein, effective in prophylactic treatment in mild asthma, well tolerated and has less side effects. Mechanism of action of leukotriene antagonist. These drugs competitively block the effect of cysteine leukotriene, leukotriene C4, leukotriene D4, leukotriene E4 on bronchial smooth muscle. So, Montelukast and Zafir Lucas act as an antagonist for cysteine leukotriene 1 receptor and leukotriene CT4 and leukotriene D4 and leukotriene E4 act as a agonist. Next class of bronchial asthma is mast cell stabilizer. Sodium chromoglucate, nidopromyl sodium, ketotifen. These are mast cell stabilizers. They are not bronchodilators, inhibit release of various mediators, histamine, leukotriene, prostaglandin, etc. Stabilize the mast cell membrane, and sodium chromoglycate is not effective orally as it poorly absorbed from gut, given by inhalation route. Next example, nidopromyl sodium. Mechanism of action, pharmacological effects are similar to sodium chromoglycate. Approved for use in patient about 12 years of age in bronchial asthma. Ketotifen mechanism is similar to sodium promoglycate, has H1 blocking effect. It is orally effective but has a slow onset of action. Mechanism of action of mast cell stabilizer is uh, degranulation of mast cell and release of histamine, leukotriene, prostaglandin, SARS-A, PAF, etc. cause allergic asthma, allergic rhinitis, allergic dermatitis, allergic conjunctivitis. Sodium chromoglycate, nitochromyl sodium, ketotifen stabilize mast cell and stop the release of allergic mediators. Next class of bronchial asthma is glucocorticoids and subclass is systemic and inhalational. Systemic examples are hydrocortisone, prednisolone, prednisolone, and others. And inhalational examples are beclomethasone, budesonides, and fluticasone. Next, glucocorticoids secrete lipocortin, which inhibit phospholipase A2 and thereby prevent formation of various mediators such as prostaglandin, TXA, etc. And glucocorticoids have anti-allergic effects, anti-inflammatory effects, and immunosuppressant effects. Glucocorticoids suppress inflammatory response to antigen and antibody reactions, reduce bronchial hyperreactivity, do not have direct bronchodilating effect but potentiate the effect of beta adrenergic agonist, and they are well tolerated. Glucocorticoids combination of long-acting beta agonist with steroid is available. Example, fluticasone and salmeterol. And next example are budesonides and formoterol. They have synergistic action used in COPD and bronchial asthma, and side effect of glucocorticoids are gastric irritation, sodium and water retention, hypertension, muscles weakness, osteoporosis, etc. Next class of glucocorticoids, next class of asthmatic anti-asthmatic drugs are anti-IgE antibody. Example, omalizumab. Omalizumab acts to prevent the binding of immunoglobulin E to mast cell, thus prevent mast cell degranulation. It has no effect on immunoglobulin E already bound to mast cell. Administered parenterally, used in moderate to severe asthma and allergic disorders such as nasal allergy, food allergy, etc. Approved for use in patients about 12 years age. Treatment of acute severe asthma, humidified oxygen, next nebulizer, like beta-2 adrenergic agonist, the salmeterol. Next is anticholinergic agent, maybe given as a nebulizer. Next is systemic glucocorticoids like IV hydrocortisones may be given, And next is IV fluids to correct the dehydrations, and potassium and sodium bicarbonate supplements may be given. And at last, next is antibiotics. Drug to be avoiding asthma: NSAIDs, beta adrenergic blocker, cholinergic agents. Thank you.